I'm Musculoskeletal Exam, I'm an emergency medicine physician at Brigham and Women's Hospital. I also am a research fellow at the Brigham and Women's Hospital doing a Global Women's Health Fellowship. And then I wear a new hat as a co-founder and then steering committee member of Heal Trafficking, which is an international now network of health professionals that are working on human trafficking. And that came out of a desire to link all the people that are working really hard on this within the healthcare field, but have no kind of forum for communication. So this talk is going to be very clinical, so I just want to give that caveat beforehand. Some of it will be a little bit graphic, not visually graphic, but I'm going to talk about the health consequences of trafficking, and as a health professional, what I see and what I look for in victims of human trafficking, just to kind of give you a sense of some of the devastating effects, but also if you end up being a clinician at some point, that you'll know what are red flags and what are the things to look for. And I'm going to start off with a case of a girl that is being trafficked. So her name is Monique, and you're a clinician, you're actually an OBGYN, and you receive this consult to go down to the emergency room for a concern for an ectopic pregnancy, which is a pregnancy that's in the wrong part of the body, and there's a lot of risk factors. I'm not going to go into the medical side of things, but and she's accompanied by her friend Martin, who says that she's been having a bad period for a couple of days. He wants to make sure that she gets checked out and gets whatever pain medicine she needs so he can take her back home to rest up. And why is that? Because she needs to be ready for work. Martin insists on staying with her because she's afraid of doctors. How nice of him. So Monique is a pale, ill-appearing female who looks younger. She says that she's 18, but there's something about her behavior, how she is dressed, that makes her appear that she's younger than the age that she gives of 18. And you notice that she's not really speaking on her own. She kind of always looks up to Martin for the okay to say anything. And even questions that are posed to her, sometimes Martin will just answer instead of her. And when she does answer, just kind of like very short words, there's definitely a foreign accent that you hear. And that she always looks up to Martin for approval. So, because this is a small group, I'm going to make this a little bit interactive. What are some things that, even without any medical training, that you would be concerned, and based on what you've learned already, would be concerning that this person is being trafficked? I've already told you it's a case of trafficking, so, but what are some of those things?
She's looking to Martin for approval after what she says.
She lied about her age.
She lied about her age. Why do you think that that's important?
Because if you're 18, then you're an adult, but if you're younger than 18, then there can be other consequences.
And as we learned from the TVPA, if somebody's under 18 and they're involved in the sex trade, then that's automatic trafficking. She may be concerned that she might be prosecuted as a prostitute. She might not know that law, but there's that distinction of 18 being child versus not young.
It's weird that her friend knows about her period and that affects her work.
Yeah, usually it's a guy that's brings that up. It's like, why is the man talking about her period? This is just like, it's odd. Something's off. Yeah.
She doesn't seem healthy. She looks pale.
Yeah. Why is she malnourished? Why does she look ill? Anything else? Those are the major. Good. So you guys can all be doctors. So I'm going to, in a moment, I'm going to go through some of the things that are those red flags on physical exam and clinically. But all of it really springs from the ways in which folks that are in a trafficking situation, that are victims and survivors of trafficking, the ways in which they're forced, fraud, or coerced into that situation. So some of this is going to echo some of the things that Liz was talking about. But when you think about all the myriad of ways in which they're being constantly manipulated and coerced, then all of the health consequences of that kind of forced drug use, torture, asphyxiation, sleep deprivation, starvation, cigarette burn, so physical things that are directly physically traumatic. Sexual violence. These are all things that, as I talk to survivors, these are all real. Rape, gang rape, rape with denigrating rituals. So, you know, if a girl isn't bringing in enough money, even in a given night, maybe she's gang raped as punishment, and oftentimes that may be in front of other girls as kind of a demonstration that this would happen to you if you're not complying with the situation. Emotional violence, so shaming and humiliating, alternating acts of kindness with acts of violence. So you're like always on your toes and you're always jumpy, like, is he gonna be nice to me? Is he gonna buy me a purse, or is he gonna beat me and rape me? Isolation, restricted movement, coercion and threats. So threats against of violence against family and blackmailing, and these are real threats. You can imagine that if somebody is transported by the Russian mafia, you know, if they're saying they're going to kill your family, they're probably going to kill your family. So these are very, very real, and you can imagine the psychological trauma that would come along with that. Economic dependence, so confiscating assets and money, or kind of a debt bonded situation where maybe somebody willingly crosses the border from Mexico to the United States to get a job. But you know, instead of being able to earn a proper wage, they're charged this incredible debt that's put on their shoulders just for that transaction to be able to get across the border that they can't ever make up, and so they're really enslaved. They're really in a situation where they can't get out of that, or their passports taken from them. That's another common way where their freedom of movement is then limited. So as a result of all of those kind of mechanisms of power and coercion, we have health consequences of trafficking, and these are some of the ones that have been studied. There's not a lot of data on the health consequences of trafficking. Most of what we know comes out of some studies from Europe as well as from India and Nepal. So the physical injuries that we talked about, sexually transmitted infections, kind of the more, among HIV, folks that have been trafficked with repeated sexual assault end up having more resistant patterns even to their HIV. High risk or unwanted pregnancies, and then unsafe abortions. Somaticized symptoms. So this is something that whenever somebody experiences complex trauma, one of the ways that the body responds is that it feels pain even if there's not actually a direct trauma there. It's kind of a rewiring of the nerves in a way of speaking. Dental-related disease or injury, these folks don't have dental insurance, but they also may be using substances that are making their teeth worse, and just general malnutrition and lack of dental hygiene options. Substance abuse is huge. So whether it's something that somebody would go to as a coping mechanism when they're in a situation, or the trafficker themselves may force them to use a substance, and then they get addicted. So the full range of alcohol, heroin, the full range. And then psychological disorders. And this one is particularly traumatizing. So the reality is that even after you can treat a sexually transmitted infection, or maybe there's even some residual scarring from unsafe abortions, those things we can treat in kind of like a more short-term fashion. But survivors are dealing years and years later with these psychological manifestations of their trauma experience. So access to healthcare, there's one study that said 80% of these females, of trafficking victims in the United States were females, and so OB-GYN clinics is one location. I care about this because these are folks that we see in the emergency department as well, and so that's kind of the lens that I see it through. You can imagine that traffickers will bring a victim, or a victim may come of their own accord in a couple of scenarios. One is that things have just gotten so bad that they're not able to do whatever the work is that they're supposed to be doing. Again, they're seen as property, and so if that property is not earning them money, that's whenever they would end up interacting with health providers. Or if, as a way of escaping. So if there is that moment where a man, a girl, a boy is able to kind of like flee and get away, healthcare settings for many place, so those are other ways that people may present. So to community urgent care clinics, emergency departments, and then to OB-GYN clinics and Planned Parenthood, sometimes for abortions. So I'm going to talk through how I think of this as a clinician in terms of the red flags for human trafficking. And the way that I organize all my thinking clinically is according to the physical exam. So maybe some of you get exposed to this, maybe not. Every physical exam starts with kind of the general exam. So that's what, whenever I walk into a patient's room, what I see before I touch anything, before I even like speak a word, just my general impression and what I see in the room. And so some of those things that might be red flags on physical exam are the malnourishment that we saw in our case at the beginning, that discrepancy in age and behavior. Usually I have some basic demographic information that was provided at registration on the patient. So it may say on that paper that she's 18, and I'm like, you know, why is she holding a teddy bear? Something's off there. Or in the cases of sex trafficking, they may present in the middle of the night in clothes from working on the street. In lingerie, there's one survivor who was talking about the fact that if she went to a health facility, she would often be wearing the clothes from her sex work and wouldn't be wearing underwear, but would just be wearing pantyhose. And none of these things are, if you see this, then definitely they're being trafficked. All of this is a pattern recognition, and a lot of medicine is that way. You use all of the different cues and information that you're getting from a scenario, and that helps you to figure out what's going on. So on musculoskeletal exam, so this is the muscles and skeleton of the body, signs of physical abuse. So not just specific to human trafficking, but some of this pertains to other victims of violence, sort of repetitive violence. One of the things that we'll see is bruises that are in multiple stages of healing. So we've all had bruises, maybe only when you were a child. Now you don't have any bruises anymore, but you've seen them go from like very dark, and then they kind of like lighten out, and they also kind of sometimes turn like orange or brown and yellow and red as they're kind of fading away. So somebody that would have scattered bruises where some of them look fresh, some of them look old, that's concerning. Or, you know, just having lots of bruises in general in and of itself is concerning. Broken teeth, multiple scars. I met this survivor who was a labor trafficking victim from Cameroon, who said that she was like 8 years old, and her trafficker would bring her to the emergency room to get medical care. She didn't speak English, and she's like, I had all these scars, and nobody ever asked me about the scars. They never got a translator. And one time she came in with a broken bone that was like poking through her skin. Things were, you know, really bad, and she got an especially bad beating. And nobody separated her from her trafficker. And you know, the cycle of violence continued for her. On skin exam, so tattoos can be a sign of trafficking. So lots of my patients have tattoos. Many of them are proud of their tattoos. So usually I'm like, whether I'm trying to distract them as I'm examining, say their abdomen or something else, oftentimes I'll talk to the patient about their tattoos, partly just because I'm curious. And there's always a story of some sort. And so what would be different in the case of a trafficking victim is maybe they're not so proud to tell me. Maybe they're actually like fearful when I'm like, oh, whose name is that? Because, you know, if it's their boyfriend and there's a good relationship there, then they're happy to tell me about that. But if there's just like that reaction is more fearful, then that would be a clue that something's up. Other types of branding, there's a case in New England where a trafficker was like using a vegetable peeler to cut chunks of skin out of his girl's cheeks as a type of branding. On genitourinary exam, so this is kind of like a pelvic exam, and these are more specific to females here, but evidence of sexual trauma could be male or female. One thing in the case of male sex trafficking, things may be stuck up the rectum, like retained foreign bodies. And for a female, oftentimes these girls are forced to have sex during their periods because they need to keep, again, their property, they need to keep making money for their trafficker. And So they get creative. They'll put cotton balls up there, baby wipes, sponges. I've heard and seen the full gamut. So that's not typical. Sometimes people get things stuck up there, but usually it's not of those sorts. And then signs of multiple infections and scarring. I hope this isn't too graphic. So on social sexual history, again, these aren't things that I'm necessarily going to ask. It just depends on the scenario. It depends on the level of trust in the room. It depends on a lot of different cues that I'm getting. But if I'm asking a younger girl about sexual history and she says that she's had many, many sexual partners, that would be concerning. If there's somebody in the room and they're referring to, or not even in the room, but if you hear them talk about somebody like daddy or talking about an older man, that would be concerning for that kind of pimp situation. A lot of these are very sex trafficking specific. And then drug alcohol addiction, and this is something that when I train healthcare providers, there are tons of folks that we deal with on a daily basis that have drug and alcohol addiction, unfortunately. And I think a lot of times those same patients, those same folks are not necessarily the ones that evoke our sympathy. You know, we think of a trafficking victim as somebody that would, you know, like make your heart bleed if you want to reach out to them. But because of the complex trauma that they've experienced and because of the drug and alcohol addiction that they're experiencing, they're coming to any interaction, and even with somebody where there might be a power dynamic like a healthcare provider, maybe not being nice and pleasant and sweet, but really showing that they're suffering through maybe defiant behavior or the like. And so this is something that I really highlight as a red flag because it's the opposite of how our brain kind of turns on when in reaction to somebody that's talking to us in a defiant way or giving us a hard time or is, you know, completely high. And so I really try to bring that point home. And again, there's lots of folks that are not being trafficked that are presenting that way. But so that was very short and sweet. I just kind of wanted to give you the nitty-gritty of the health side of trafficking, and I'm excited to talk about kind of next action steps. And we have a breadth of experience here. So, and as you guys think about how you want to engage with this issue and how you want to engage with any issue, my general recommendations are to think about what you're really good at, what you like to do, because you should do those things. That's you shouldn't, if you're not interested in medical side of things, you shouldn't pursue that at all. This is my email address.